Myself, Dr. Asma Muhammad Shaukat from I am an ENT specialist and family physician as well. Hope you all are doing well. So I'll be taking today topic for general. It's general. It should be it should be like everyone should know about this. It is nothing but the history taking and clinical examination. Every doctor should be aware of all this, but some important points I'll be telling you, which a specialist will be knowing. Okay, should know. Okay, so today we'll start with the. This is an overview. Okay, so let us start with the principles of history taking. Okay, so day to day life. Like I want to just confirm my voice is clear to all.
Your voice is clear. You can start the class.
Is the slide visible now?
Yes, ma'am. Everything is visible. You are audible. You can start the class.
Next, going to the cardiovascular examination. Look for cardiovascular examination. More important is the heart rate. Okay. Look for the cardiac murmurs. Okay. Systolic murmur, diastolic murmur, and their grading. Okay. Grading grades are 1 to 5. Okay. So just note down this grading. Just note down this grading. This part you just note down. Cardiac murmurs, systolic, diastolic, and grading.
Great diagnosis doesn't start with reports. It starts with strong clinical skills. Every symptom tells a story, and every question leads closer to the diagnosis. Accurate examination reduces confusion and saves time, because investigations support clinical judgment. But clinical reasoning makes the real difference. Better diagnosis means better patient outcomes. Upgrade your clinical approach with practical learning. Master clinical skills, improve diagnosis, become a more confident doctor.
Okay. So what are the key takeaways? Listen to the patient first, adapt to the age. Okay. If you are thinking if there is an airway compromise, okay, take the help of an emergency physician immediately. Okay. And documentation. Okay. In our cases, family, as a family physician, documentation is very important. And red flag signs. Okay. More important red flag signs can be first is airway, breathing, as I told, circulation. Okay, blood pressure not recordable, pulses not recordable. Okay, sugar has gone down, hypothermia, hypothermia. So these are the cases. Epilepsy. Okay, seizures. Okay, so some patients, case one. Okay, in cases of breathless patient, breathless chest pain. Okay, the chief complaint here would be whether the breathlessness is at the rest or on the exertion. Okay, this is important. Why it is important? It gives clue towards the diagnosis. Okay. Next, how is the patient feeling? Just example. Order the ECG. Okay, within 1 hour, let him get it done. Okay. Normally nowadays, the ECG in the initial assessment, ECG comes normal. Okay, most of the time. So repeat the ECG. Ask the patient to wait for another hour, another 1 or 2 hours, and repeat the ECG after 1 or 2 hours. Next is Miss Priya, 28-year-old teacher, presents with 18-hour history of periumbilical pain, now shifted to the right iliac fossa. Okay, so I was telling about the quadrants of the abdomen where you can point towards the diagnosis directly. Okay, she has right iliac fossa pain, anorexia, low-grade fever. Okay, around 37.8 degrees Celsius, and 1 episode of vomiting.
Acute abdominal pain, simple gastritis, or a surgical emergency. First step, assess vitals, pain location, onset, and associated symptoms. Look for red flags, guarding, rigidity, fever, shock, or persistent vomiting. A focused abdominal examination can narrow the diagnosis within minutes. Appendicitis, cholecystitis, pancreatitis, perforation, every quadrant tells a story. Use investigations wisely, CBC, ultrasound, amylase, or CT when required. Rapid clinical judgment can prevent complications and save lives. Master real-world clinical diagnosis with Medical Global Academy.